Hello, everyone. I'm Gloria Bettis, President and CEO of the Women's Foundation of Minnesota, and I'd like to begin our time together by first acknowledging those who are of this land, the Dakota, the Ojibwe. In addition, we recognize our Black ancestors who were taken from their homelands and brought here involuntarily to build this nation. Our aim is to respect those before us, those among us, and preserve and conserve the land for those who are yet to come. Thank you for being here for our final listening session on the Women's Foundation's Road to Transformation, a time in which we are intentionally gathering in community to deepen our understanding of real lived experiences with the issues faced by women and girls in our state, so that we can strategically reduce or eliminate the challenges, barriers, and obstacles women and girls face because of inequities and injustices in our system. Since the onset of the pandemic, we know that women, particularly BIPOC women, have been disproportionately affected by this crisis, in part because of the work they do on the front lines as care workers in hospitality, retail, food service, and as caregivers in healthcare systems and at home. Over the course of the year, we have seen the long-term economic implications borne largely by women, leaving the workforce in droves because of the demands of caring for children and families as schools have remained closed or workplaces have shuttered. Today, we're here to listen to the testimony of women and gender-expansive people who work on the front lines during the pandemic, along with experts who well know the systems and issues that create barriers to equity and well-being. As we make connections to our Leading Status of Women and Girls in Minnesota report, created in partnership with the Center on Women, Gender, and Public Policy at the Humphrey School, and the center's research on unequal impacts of COVID-19 across women and workers of color, we are expanding our understanding of how systems must change so that all women and girls in Minnesota can thrive. As we look at the data in the report, we know our state's women and girls are not broken, but rather our systems were not created with equity in design. In order to create meaningful change, we need to turn to the experts like those on our panel today to hear lived testimony about their experience, challenges, and opportunities they see to create sustainable solutions so that we may create a more just world together. One that puts the experiences and ideas of communities pushed to the margins at the center of our way forward. In response to the pandemic, the Women's Foundation of Minnesota leveraged its responsive grant-making infrastructure to launch the COVID-19 Women and Girls Response Fund. In the last year, we have awarded more than $1 million in emergency grants to grantee partners statewide who have been functioning as first responders in a crisis. They have experienced unprecedented demand from our communities across intersecting challenges caused by inequities in our system. Partners are there for their communities as advocates, as support networks for women and girls experiencing gender-based violence, older women, policy and advocacy, and women and girls who need short-term financial support for childcare, elder care, food, transportation, housing, health and wellness, and safety from violence. After 4 rounds of responsive funding to address the impacts of COVID-19 of Minnesota communities pushed to the margins, the continued need for long-term recovery is going to inform the Women's Foundation's grant-making processes, our priorities, and policy for a long time to come. Addressing systemic inequities exacerbated by the pandemic while reckoning with the adaptation and innovation required in times of crisis will infuse every Wfmn funding area, research, strategic partnerships, and advocacy. We know recovery will take longer for women and will call for a transformation that honors, values, and protects the work women and girls do, both paid and unpaid. Like all of you, I am ready to listen, learn, and act. We can truly transform if we follow the solutions of community members most impacted. And so now I'd like to turn it over to Lacora Bradford Kesty, the Women's Foundation's Director of Community Impact, who will facilitate today's conversation. Thank you, Lacora.
Thank you, Gloria. Hello, everyone. I'm Lacora Bradford Kesty, she, her pronouns, Director of Community Impact. I want to thank you for being part of this opportunity to listen, learn, and to co-create new solutions as we imagine a world in which all women and girls can thrive. We are here today to listen to you. We hold your words, time, and wisdom in such great honor, and want to thank you once more for sharing this space with us. I'll share a little bit about how our time will go. Today, testifiers will share their experiences as essential frontline workers in the time of the pandemic and the uprising for racial justice. We are here to listen to your reflections, your vision for the supports that you need, and what it takes for you to be safe and well. We are here to learn more about what you need both now and in the long term. Each testifier will take 3 to 5 minutes to share prepared remarks. And next, we will hear from contextualizers who are here to speak to their areas of expertise and ground the story shared in research, data, trends, and expanded experiences. I will facilitate a conversation with all the panelists and welcome the various insights that I'm sure will come up. Our listening session engagement principles for Wfmn include: 1, we are here to build and protect a culture of trust, authenticity, confidentiality, and transparency. We honor your agency over your very own story, and we are committed to actively listen. For Zoom tech, if you have a lot of background noise, we ask that you please mute. And if you are in a quiet space, it's okay to keep your mic on so you can participate more easily. Please check now to see your name is appearing on the screen. In Zoom, you can click on the 3 dots beside your name to change your name and add your pronouns if you wish. Haley, our team member, is here to hear if you have any tech needs. So hi, Haley, thank you. We will be recording this discussion today, and your comments will be used to inform our report. We are also live streaming today's session so we can amplify this conversation. Let's start the session. So our testifiers today are Adriana Goodwin from COVID Sitters, Pony White, a member of the Young Women's Cabinet as part of the Young Women's Initiative of the Women's Foundation of Minnesota, Adrian Thayer, a nurse from Ramsey County, Carla Mentz, owner of Iron Shoe Farm, Angel Matthews, HR Assistant Manager for the Seward Co-op, Joni Lennox-Goulart, Elder Care from Fairview Health, who will not be with us today as she went into labor. And so let's give her some good energy as she brings her baby Earthside, yes. And today our contextualizers are Alicia Kozlowski, Community Relations Officer from Duluth. Did I get it right, Alicia? Elizabeth Ebot, Director of Vaccine Outreach, and then Dr. Christina Ewig, Director of Center of Women, Gender, and Public Policy. So thank you all for being here today. Whew. All right, so research by the Center for Women, Gender, and Public Policy at the University of Minnesota revealed COVID-19's ongoing disproportionate economic impact on women, particularly for women of color and Indigenous women. As drivers of the care economy, women, particularly Black, Indigenous, and women of color, are taking care of Minnesotans as healthcare workers for tens of thousands of COVID patients across the state, as retail and service workers ensuring access to food, as child and elder care providers, including unpaid care workers who shoulder a disproportionate burden of care work for our state's most vulnerable residents. It is in this context that we listen to the experience of today's testifiers. So we will start with Angel. Angel, your work has included working on the front lines of a grocery store. What has been your experience as an essential worker during the COVID-19 pandemic?
Oh, well, I will start by saying that initially, my experience, and I was the front end manager for our friendship store location at the start of the pandemic, was fear. It was terrifying to go to work. Um, there was a lot of unclear information coming out. Some people believed it, some people did not. There was also a very large panic in the beginning where people were stocking up on groceries and clearing shelves. And so workers were really, and myself included, were really struggling to show up well for our community members and not want to go into the back room and hide because, you know, the store was busy. And this was before social distancing was like, you know, mandatory or became, you know, a lot more of a practice that people did. People were not wearing masks. We didn't necessarily have you know, mandatory requirements at the time. We quickly adopted those practices and put up other safety measures for our employees very quickly. But, you know, for the first couple of weeks, it was really scary. And I will say too, the public was initially either for or, you know, not necessarily against, but, you know, everybody kind of wanted, or there was a large group of people who wanted everything to be normal and everybody to be able to do what they normally did. And, you know, you have essential workers, grocery store workers that are asking for space and asking for people to protect them by coming into the workplace into their workplace in a safe way. So yeah, being an essential worker in my experience in the beginning was terrifying. I will say that I had quite a few breakdowns emotionally, mentally, every day, whether it was going into work, whether it was being at work, coming away from work. You know, the fear around what else could I do? Like, could I get a different job? And that reality, like, no, there's nowhere to go right now. There's, you know, if you want to keep a roof over your head or keep food on the table, the only thing you can do is really suck it up and go to work. And so that made being an essential worker really hard. I'm fortunate. There's also the flip side of that is you know, the reality that I was fortunate to keep my job also at the same time, where others were not as lucky. I also don't have children, so I didn't have to worry about my children leaving school and all of a sudden having to be at home all the time. But I definitely had a lot of experience with customers and employees who did have that situation at home and people who had to make ultimate sacrifices around going on unpaid leaves or things that, you know, of that nature, where they just had to make really hard choices. So I think the scary part about being an essential worker in this type of situation is just that there is no other option to do something else usually where you're going to be able to sustain, you know, your financial well-being, you know. And so, yeah, that was my biggest experience, was really around mitigating my own fears and insecurities around the virus that people didn't know about at the time, especially, and, you know, also mitigating fear and concern that my employees had at the time. And then on top of all of that, when it seemed like we were getting used to, okay, partition, social distancing, and masks, the store that I worked at the time was also right in the neighborhood, directly down the street from the location where George Floyd was murdered. So that added an extra, it compounded fear on top of fear on top of fear. And it made it really difficult, I think, for everyone. You have a fear of an unknown airborne virus. And then the majority of the employees, the majority of the customers and community members around us are POCI, are BIPOC people. And, you know, where you think you should be able to be safe walking down the street, going to your corner store, going to your local grocery store was just blatantly like,
yeah.
put on camera as like, no, don't feel safe at all, ever. So yeah, it became really hard in general, I think, just to want to keep going and wanting to show up well, and like I said, not wanting to hide from everything.
Thank you, Angel, for lifting up the experiences of essential workers in grocery stores. There was so much in your story, and I know we just scratched the surface. I want to hear and affirm that it was terrifying and layered, and that you had to mitigate all of these experiences. Mm-hmm. And so now I'd like to invite Pony to speak. Pony, as a young women's cabinet member, what has been your experience as a childcare provider during the COVID-19 pandemic?
Okay. Want to share first that I think my story is very interconnected and very much centers the experience of my mother, who gave me permission to share this, cannot be here because she's currently working. She is an essential worker in healthcare. She is a CNA at an elderly elder care home. And when COVID happened, I remember the first concern was for my siblings, because schools started shutting down, and they were giving parents, direct information on, how to, help their students by help their children going online, and what they would need to prepare their children for classes and courses. And my mother is a West African immigrant woman, and is not very like tech savvy, and also, like I said, is a single mother who was also an essential worker. And so that was a big concern of hers. I remember that night where she was kind of like, okay, like, how do we, plan all of these things and prep all of these things? At the time, I want to state also that I am not a childcare provider. I work on childcare policies. And at the time I was in my undergrad, and I lived 4 hours away, but I knew like right away that, okay, my parents are going to need support. And as somebody who has always been very instrumental in assisting raising my siblings, I knew like this was something that I definitely needed to assist them with. And then as COVID got worse, my mom kind of grew very scared because she knew like she was, working directly with people, and trying to make sure that they were safe and trying to make sure my siblings were safe. And so we had to make the tough decision to send my siblings up to live with me for like pretty much like a couple of months until things kind of got a little better around like April, May. And so my siblings came to live with me, and at the time they were 7 and 14. And so it was kind of changing around like my life to center like how to help them with their education, and how to, like assist them with Zoom classwork, and, contact their educators, and also keep my mom in the loop, and just how hard that was on her emotionally, and also just like the fear of like her getting COVID was a whole lot of work and a lot to process. And then for me on my end, I was working at a nonprofit organization that centered like assisting immigrant communities and BIPOC communities, people experiencing homelessness, people experiencing job loss, people trying to apply for green cards and different things like that, and IDs and work permits. And a lot of my work was based on like directly helping like those communities, and it wasn't things that we did behind a computer. Sometimes it was spending like an entire day with someone and trying to help them like prepare a resume, and so having to kind of pivot out of that, it was a big concern also, like that I was having, of thinking of like all the people that we were like helping every day, and now like not being able to see them, and so many people that we were on like a text a phone to phone basis, where they would call me and say like, hey, I went to the job interview, and this is how it went, and I need help with this, and can you send me this? And now having to like tell those people, especially early on into the pandemic, having to tell those people like, I'm sorry, like, you know, we can't meet up, or, you know, the office isn't open. And then some of those people saying, well, like, I took a bus here, and like, you know, like, how am I supposed to get back? Or like, what am I supposed to do about work? What am I supposed to do about housing? And so like, those are a lot of like the different, you know, concerns that I was having at the time. And then again, like I said, centering in this conversation, I think it's very, very important to center my mother's experience and her story, because I think it shows just how much like the work of women influences their entire families, and how, you know, her being an essential worker like changed the dynamic of like how our lives were set up and where my siblings had to go, and even their own experience. And so it was just a lot of pivoting and changing. Yeah, I just want to highlight that being a part of the cabinet like brought a lot of help in navigating that space, but it was something that was very difficult. And I do see like, again, how much women influence like the entire dynamic of their families, and how COVID created barriers to that.
Thank you so much, Pony, for sharing that. What I hear in your story is that women are caretaking in multiple ways during this pandemic, from taking care of elders in the workplace to you taking care of your own siblings in your home in this working dynamic. So thank you for sharing that. Next, I'd like to hear from Adrian. Adrian, as a nurse, what has been your experience during the COVID-19 pandemic?
Hello, yes. So I am a divorced single mother of two, a 15-year-old daughter and a 12-year-old son, and my 66-year-old father also lives with me. I'm working in public health and emergency, so I have two jobs. So this was very fearful in the beginning. As I kind of been watching this virus from China, as I love all things global and infectious disease. And when it first came here, I wanted to know how I could help as most as I could, because we weren't really moving in public health. And so I started picking up lots of hospital shifts to help my coworkers in the hospital and try to relieve some of the stress. After I started doing that, my ex-husband got very nervous and decided, kind of like Pony's story, that we had a discussion and he decided that having my two children come and live with him until things could settle down or we knew more information was the best option. And at that point, I was very hurt by that, but I understood, and I figured I would take that opportunity to give back as much as I could, because I just never felt like I was doing enough out here. I'm a tuberculosis case manager on my public health job, so I was already very comfortable with infectious disease and being around people that had infectious disease. So we never stopped doing home visits in public health, and we still continued to do, we limited our care, but we still continued to do direct patient care, which was very nerve-wracking for a lot of my employees and other people that didn't do direct patient care in the building. We were still coming in and out. I was working hospital shifts coming to my public health job, afraid that I was going to infect my coworkers. So I was one of the first people that started wearing a mask even before they were implemented in our workplaces, because I was doing so in the hospital, and I didn't make sense to not do it when I was at my main full-time public health job in our office building as well. So I've taken care of a lot of COVID positive patients. It's been very scary. It's been hard on the patients, and I've seen how badly not having visitors in the hospital has probably been the hardest thing on the patients, and really having to be there at the bedside with people and in an emotional way because their family members can't be there. Really, we had to change the model because we'd always really let family in. Nursing is already spread very thin. So it was very tough to be spread so thin. Everyone's afraid of an infectious disease. And now you have all of these your patients are in isolated rooms and having all these emotional experiences by themselves. So it took a lot more time to do everything as well, which also added stress to all of the staff because they just weren't used to that. I, as a casual nurse, was, I think, more compassionate because I wasn't doing it day to day in the emergency department anymore. But it's it's work that will burn you out. So I think a lot of my coworkers were burned out before the pandemic, and this just kind of set that over the edge. We've seen a lot of turnover, a lot of loss from people leaving and wanting to work from home, a lot of women leaving the field. I've seen that in my patients as well, my public health patients. I know that during this time, most of my patients don't speak English, and they were sick with infectious disease to begin with. When the toilet paper rush hit, I remember stocking up just on toilet paper in my office at public health just to give out to my patients because they had no means to get it. And I felt privileged that I had a car to go to the store to be able to go buy it on the, when you could get your 2 per day. So I would try to stock up just so we could try to help people who couldn't get those services. When George Floyd was murdered, I was working that night in the ER. He came in actually, I'd say an hour after I left my shift. And after that pretty much changed everything. I would say it changed everything. All the emotional support I thought I had with coworkers and even family was kind of risen to the surface, that we all kind of viewed the world in different ways. And I didn't really have that emotional support that I thought that I did, even from my own mother. So I'd say that, just like Angel had said as well, it's been so many emotional breakdowns, leaving shifts, coming to shifts, just in the middle of the day, crying with my patients about what's going on outside, on top of now we're combating a pandemic and an infectious disease, and these systems that have been oppressing people of color for so long, since the beginning of this country, essentially. So it's been, it's getting better now. I would also say the self-care piece, I also have bipolar disorder and I've been in therapy. The self-care piece I was lucky to already have an established relationship with a therapist and health insurance and a job that was flexible enough to allow me to change my schedule so I could be more there for my children when needed. But a lot of my patients and coworkers don't have that. And it's very hard to establish a relationship with a therapist through a computer screen. If they are wanting mental health care, I think it's really shown the lack of resources and ability for people to access help when they need it. I feel very grateful that I had a job and still have a job through this pandemic, as I've watched so many women have to leave the workforce because they need to stay home and care for their children now. And that's probably saddened me the most. I feel like we're moving backwards.
Thank you. All I can say in this moment is thank you for your work that you led. I think we understand essential as a word, but hearing your story makes it a verb. It's important to make sure that we see healthcare workers as full human beings with distinct experiences and feelings, just as much as the patients that you take care of. And so I honor your story and really appreciate you for sharing. So thank you, Adrienne.
Thank you.
That hit. So Carla, I would like to hear from you as a farmer. What has been your experience as an essential worker during this COVID-19 pandemic?
Hi, everyone. I'm Carla Mertz. I own Iron Shoe Farm. We're located in Princeton, Minnesota, in central Minnesota. And we were a 7-year-old diversified farm, meaning we raise livestock and some small vegetable crops. And we were selling to 45 restaurants in the Twin Cities metro area. And the day that the governor had shut down our state restaurants, we lost 100% of our business. And I personally worked really hard for 3.5 years to build that business. And within a blink of an eye, it was gone. And we're farmers, we produce food. Whether it's sold to a wholesale or retail account, it ends up in the hands of the consumer. And so for me, hearing that those restaurant accounts were closed, I received a huge pit in my stomach. I didn't know what that would mean moving forward for us, except the fact that I went online and I had to pivot. I had to create an e-commerce website. I had to start tapping into a new market, direct to consumer, in hopes that we would be able to move product. We had to donate thousands of dollars worth of a microgreen product that we grow because it's a perishable product. We had butchering dates that were set for a couple months out, but then the rest of the season, we were really limited to what was available. I'm sure many of you heard the issues that hog farmers were having. We were in that same boat with having dates on the books, and then all of a sudden, your butcher calling and saying, "I'm sorry, I can't get you in, we're triple booked." So meat processing in the state of Minnesota, even with poultry, is at a huge lack right now. So it's really, really difficult to plan what you're doing as a farmer. And right now we have dates that are booked out 2 years from now, and it's really hard to plan a business that far ahead, engage and not overproduce, because we want to be sustainable. And things are rising in cost, which is really difficult as a farmer as well. For example, my poultry feed went up by $300 a ton for just my chickens. And I don't know if people are going to pay us what we would need to get paid for a chicken, meaning my cost is now $12 a bird, and the consumer's price is going to go anywhere from $20 to $25 a chicken. And that's the story of a small farmer. Like myself, there's many of us around. They're feeling the aches and pains of an industry that had to be forced to close, and now we're just slowly rebuilding. It's almost like we're starting over. And I can go on and on. We're huge advocate for farm policy and that, and have been testifying at state levels with processing, and even some new regulations coming down the pipeline for us to sell to the consumer and what that means. So it's really important to really reach out to local farmers and buy local, because their livelihood depends on it. I'm fortunate that I'm married to my husband, who has a full-time job, but I personally had to take a job off the farm in order to keep feeding my animals throughout the remainder of the year. So it's been difficult. I now have 3 jobs just to make sure that my farm keeps running. That's the reality of it.
Thank you. Thank you for sharing that. Small farmers are having, what it sounds like is small farmers are having very hard, or it's very difficult for them to be making money at this time. And so it's critical we amplify your experiences, especially in rural Minnesota and greater Wfmn. Local farmers, especially led by women, are critical members of our community, and your livelihood impacts our livelihood, essentially. So thank you for sharing your story, Carla, with us. Now, I'd like to transition to Alicia. Alicia, as a woman with many intersecting identities and also living in greater Minnesota, what has been your experience during the COVID-19 pandemic?
Bonjour and hola, everyone. Ozawa Anakwadukwe, Indigenous Kaz, Magizi Nintoden, Masabi Kong and Dunjaba, Nagaji Wanang, Minawa, Kichi Onagaming, Bizandawiyeg. I shared with you all My name is Alicia Kozlowski. My Ojibwe name is Yellow Cloud Woman, which means that person that like goes ahead for hope for brighter days, from the Grand Portage and Fond du Lac reservations, and also am Mexican American. My pronouns are she and her. And wow, yeah, a lot of what I've heard resonates so deeply with my experience in COVID. And I think a lot of times as a Native person, as an Indigenous person, I'm asked over and over and over again, like, why don't you just get over colonization? And I just share with people that it's impossible, because my life, and I look around at my community members who I love and adore and I'm rooting for so strongly, very much experiencing the impacts of colonization residually and viscerally today, and especially even more so amidst this pandemic. And so personally this past year, I have had a perpetual COVID headache, as I call it, like the tension in your head and in your jaw, and you can just feel it in your body. And I think for communities who have experienced generational trauma, we're so used to always just being on and in fight or flight or freeze mode. And as we learned in this last year, right, that's not good for us, and it makes us sick. And so in the COVID pandemic and previously has been so much about like, how do we come home to ourselves and to each other and be in good relations with one another? In my life, pre-pandemic, I'm one of the only family members in my immediate or extended family who doesn't experience or struggle with addictions. And so just all that stuff, right? It has been so zoomed in on. In the past year, in my circle, again, in my immediate family, my auntie, my uncle, and my mother have all walked on due to underlying health conditions that just with COVID, they weren't going to the clinics, they weren't taking care of their heart disease, their diabetes, all of it. And then also just the adjacent struggle again with addictions that was been grief on grief on grief. And I'm really fortunate that as a queer person, I have a partner and I have a 7-year-old, and my partner's family, you know, they've experienced COVID, very real. And so when I look around at like, whether on our Latinx communities or Native communities or other communities, like we're really living it, and we can look at the data, but then there's like the real life aspect of it. You know, a year ago we closed City Hall. So I work, as Lacora said, at the mayor's office in the city of Duluth, and we closed. And you know, I had to go pick up my kid. My child goes to the Masabikang Ojibwe immersion program in Duluth, and I don't know what I would do without that program, because it has my community members and my child's Wfmn, which is like her auntie, and they've checked in and provide food. Do you need technology resources? Like, what cultural spiritual supports do you need? And even then, oh my gosh, it was the toughest year. And just in the past couple of months that my child transitioned back into a school setting, for me, working from home and also working in the capacity that I do, I definitely grew a patch of gray hair this year, is all I can say, because it was so stressful. And there were days we just like both sit and cry because, you know, she's working on a computer and we were sharing a computer, first of all, and our Wi-Fi was constantly always cutting in and out, but my child isn't at an age to be able to read or to write. And so my daughter it's just impossible to do a Zoom class or any of those learnings on her own. And so, you know, trying to sit side by side and do work, it didn't work. And we had the added reality of my child switching homes. And so then you add in the like, oh, your extra exposure, and then thinking about like, it made it so that I couldn't show up for my family, for my community, because I was really, really terrified all year of spreading COVID and then that out of the year that more people wouldn't make it. And so that was really difficult. And then on top of that, it's the added childcare, skipping healthcare visits, the social isolation. And for me, my brother and my family members experiencing homelessness. My brother had been living in a tent city out of state. And so I ended up having to go out and get him. He was in a mental health addiction facility, and getting back to Minnesota and navigating the criminal justice system. We had a warrant resolution clinic in Duluth, and they were so extra empathetic. And thankfully it was a person of color that we were able to work with through that warrant resolution. But, calling in on Zoom when my brother didn't have access to a phone or technology to try and get that warrant worked out so that, when he got back to Duluth and back to the reservation and set up, that wasn't an added barrier that we had to worry about. And so just like all of those layers, right, then I could look around and share story on story of community members who have experienced, like the impacts of COVID or committed suicide. I think we've lost 20% by some estimates of our first language speakers, but then I also look around our community and I see the way that we've adapted. And I think a lot about what our elders and what my grandmas and aunties and matriarchs have taught me is that as much as we've have through our DNA the negative impacts of colonization, that also means that we have tremendous resourcing and resiliency. And this is not the first pandemic that as Native people we've had to endure. And so just that reminder that we're not alone, that we're constantly finding new ways to adapt, to acclimate, to thrive, and to love, and to stay connected, even if we have to be socially distant. So I will pause there.
Thank you. Thank you, Alicia. Your name means going forward to brighter days, and that's exactly our collective hope in this time. So thank you for sharing your story, and my condolences for your family, for your loss, and your experiences. I hear so many intersections of issues and identities, and I hear, and I'm thinking about your identity as a Native woman, and I think about how often Native people's experiences in the pandemic is not lifted up because of the population size. But we know there is no authentic way of equitable solutions without working from the margins. And I also want to recognize that many tribal communities have been innovative, utilizing cultural practices and memory to address the impacts of COVID-19. So thank you for sharing. And before we move on, Joni did, while she was in labor, the Power of Women, wanted to share some remarks with us. So Joni is an elder care worker, and she said that as a pregnant woman and director of low-income housing supporting 192 seniors, she experienced an emotional pull between being a leader and a mom. And she believes there is a huge need for mental health support and mental health awareness for essential workers. And I think that was a resounding theme of like as essential workers, you all need support. And so I would like to go to Adriana next. So Adriana, can you now share your experience with this COVID-19 pandemic?
Bushu everybody, Adriana Goodwin, Indigenous Cause, Swashkubanesique Nindigo, Mayinga Nindudem, Misquagami, Wizaga Gunning Nindunjaba. Greetings everybody. My colonized name is Adriana Goodwin. I am known to the spirits as Blue Thunderbird Woman. I am from the Wolf Clan, and I am a citizen of the Red Lake Nation. And it is an honor to be here with you all sharing this space. And, I really share similar sentiments to everything that has been said thus far. And I'm here today as a part of the work that I do with the Minnesota COVID Sitters. We are a nonprofit organization, and the response that I'm going to give is kind of a collaborative effort on behalf of the board members. And so I'll go ahead and share our experiences. When the virus first started to be transmitted here in America, we saw desperate social media posts from healthcare workers across the country as it made its way to Minnesota. We even felt a sense of hesitancy from our teachers and mentors because of the uncertainty that the virus had. And while that uncertainty has eased over time because new data and research is constantly emerging, we are still in a time of crisis. And in times of crises, we come together for a common goal. And that's really what the Minnesota COVID Sitters is about and wants to achieve. Our organization really started to feel the depth of the issue around lack of childcare for healthcare workers. And I think a lot of caregivers can share similar sentiments of a need for quality childcare while working on the very front lines of the pandemic. Our volunteers are first background checked before being matched with a family. And sometime last year, we received a request from a healthcare worker, and she was looking for, she needed childcare for 4 12-hour shifts. And our administrative team was able to get volunteers on all 4 of those days, so this person could continue to provide healthcare for those in need. I think for all of us who are part of the Minnesota COVID Sitters have shared similar experiences over the course of the pandemic. In experiences, maybe not in a professional context, as we all come from different professional backgrounds, but the similar experience of a desire to build community in a good way. And in doing so, we realize that despite our differences as humans, we love and grieve in same or similar ways. Before coming to the Minnesota COVID Sitters, I actually worked for the Red Lake Tribal Government. And as you guys all shared your stories, it really impacted me because I was, a part of those decisions that needed to be made, right? Who's essential, who's not. And when she shared the story of the farming, right? One thing that I was able to do in my work for the tribe, I was able to establish relationships with local farmers, and we were able to bring in locally sourced meat to provide to community members in need. And again, it's just an honor to be here. And it's so important that we center, these stories. It's so important that we are given the space to share. And in this space, there's so much knowledge and expertise and wealth, to really catapult us into the future so we all can have, a good life. And I just want to say Chimigwich for all of you ladies for sharing that and being here today. Miigwech.
Thank you, Adriana, and thank you for your work with COVID Sitters. The layers of the need for childcare and your personal commitment to your community is inspiring. And yeah, just thank you. I'm getting a little emotional because these stories are so powerful, and like you said, we need to be sharing them so that we can continue to hear what's happening. And so before we transition to contextualizers, was there anything that really resonated? I know, Adriana, you were talking about connecting, really resonating with Carla. Are there any other things that really resonated with you all from the stories that you have heard? Got it. We will transition to our amazing contextualizers. So as COVID-19 relief resources and vaccines are distributed across Minnesota, we must adjust strategies in response to the fact that American Indians in the state have suffered even greater losses due to the pandemic than official data indicates. So once again, systemic bias, colonialism negatively impact this population with fatal consequences. And so I want to go to you first, Alicia. Can you expand on what more needs to be done to support our Native communities in Minnesota?
Ooh, yeah, that's a good one. As we know, the COVID pandemic has changed absolutely everything. And it's forced us to work differently and learn differently and live differently, which I shared earlier is just like, that's what we do as Native people, like Indigenous people, we just adapt, we figure it out. And so in my role at the city as community relations officer, I've been so grateful to team up with partners locally here in our urban Native community, also with nonprofits and, you know, other adaptive networks, but also at our county and state level. We've been able to have monthly urban Native leaders calls. And a common theme of that is how we all endure in our own ways. And that's been such a crucial thing, I think, in terms of like grounding and where we start. Because, you know, our Native communities, there's 565 plus distinct tribal nations and cultures. And so like in an urban setting, being able to really have those relationships and engage across the tribal nations and within the different cultural and identities that exist in a community, it's diverse, right? And one of the things that really resonated to me from one of the other testifiers was just that, like, how terrifying, fearful, and unclear information has really added a lot of difficulty and extra barrier to be able to show up for our communities a good way. And I think one of the things is like when you don't see yourself represented in these institutions that work for you, to care for you, to support you, you're going to have that feeling of distrust. And what keeps coming to mind is like the Urban Indian Health. Maybe you've heard the story, but Crystal Echohawk from that organization talks about when that community asked for PPE, they weren't sent PPE, but they were actually sent body bags. And so Urban Indian Health turned those body bags into dresses, and they actually put mirrors on those dresses because in a lot of Indigenous communities, mirrors are used as like to reflect back out as like protection. And so it's like to reflect back out those disparities and discrimination. And so I think like really starting from that grounding place of we go at the pace of relationship and trust. And so having those relationships and communication to combat that misinformation, to help restore and cultivate and make a reciprocal relationship with our urban communities, with our tribes is really something that's needed. And I think like at the government level that I don't know that that's true for every city, for every municipality to be in contact. And so I think in order to do that, to serve so that we have an equitable distribution of resources, an equitable distribution of support, right, and time and energy. But then also like looking across our communities and thinking like within the context of our Native communities, we know that women in Minnesota have had the highest rate of exiting the workplace. So it's like 865,000 have exited. And you add on that layer of childcare and costs and looking to rejoin the workforce, we're really looking at ways that supporting Native communities, Native women in being able to, knowing that like women as the life givers, the bearer of so much in our homes, like how is it that we're supporting our women and within that gender diverse folks so that we can get to a place of financial security and however it is that we define generational wealth for ourselves, because we know that on the other side of that is rest, it's reprieve, it's being able to go and get your therapy or to attend ceremonies and to have that break. And we're also looking at workforce, and we know that 1 out of 5 of all Minnesotans who are unemployed or underemployed are Native or a person of color. And for Native communities, it's probably an underestimate is 21%. So looking at strategies, we have developed a working group specifically for our Black and Indigenous communities in Duluth to be able to address workforce and also supporting our entrepreneurs and what's needed around there. Some of the other things that we know would be also language and culture. You know, a few hundred years ago, all that it took was one infected blanket to wipe out an entire population. And now when we lose our elders, it's like our libraries are burning down. And so knowing the history of what's happened, we're working with, again, our partners and our tribal communities are doing that so good. I would say one of the things that's been really amazing to watch is to look at our tribal health organizations and our urban Indian organizations who they have solutions for not just ourselves, but everybody, right? So they're the ones that have partnered with the Minnesota Department of Health as community care coordinators to get out that information, to get out those resources, to be the point of contact so that we have culturally responsive and specific ways, and then those resources that go along with it. And so they're the ones out there doing the calling in to our elders, calling into our families to say, hey, what is that you need? Do you need food? Do you need housing? Like all of those things. And within our vaccination programs, serving not only just our Native communities, but opening it up and recognizing that like in Duluth area, recognizing that there are many different tribal nations and some have Canadian folks who like might otherwise not qualify for Indian health services, and really expanding those services to include multiple different type of reservations and like I said, cultural identities. And so that's been really a big piece. I can go into more, but those would be some of the big things that I would share is just really a response in a specific way.
No, that's amazing. You're speaking truth to power. So I appreciate that. Losing elders is like libraries burning down. That's not going to leave me. So thank you for that. I'd like to also hear from Elizabeth doing the outreach vaccination. Can you talk more about or respond even and expand on what Alicia is talking about, how gender, race, and place play a role in getting this critical information out about vaccinations?
Yes, thank you, Lacora, and good afternoon, everyone. Elizabeth Abot, Vaccine Outreach Director from the Minnesota Department of Health. To sort of expand on what Alicia said, she's absolutely right. You know, working through trusted messengers that we know their communities, are respected within those communities, and often have much better relationships than public health relationships to date for all sorts of sort of institutionalized and long-standing reasonings that we can spend even more time talking about. But to Alicia's point about how we've been doing that and how we can continue doing that. So the Vaccine Equity and Engagement Division at the Department of Health was really created with the intent of not only providing key information to our what we call our focus communities, Black, Indigenous, persons of color, LGBTQIA persons with disabilities, but also making sure that at every point of our vaccine distribution and allocation strategy, we're rooting it back in these focus communities, in our messaging and communications. We're rooting it back in our focus communities that we know, like everyone on this panel today has shared, have just suffered some of the most intense effects of the pandemic's health impacts and financial impacts, and overall well-being impacts. So to do that, we sort of created multiple different pathways, and I'll try and go through some of those quickly. One of those are our COVID community coordinators, like Alicia mentioned. These are organizations at this point, more than over 60 organizations that MDH has contracted with. We provide funding and resources to. Sure, you know what, and I'm sorry, Haley, but I have a firewall on my MDH computer, so sometimes it can come through very quiet or fuzzy, so I apologize. I'll do my best to project. So we have over 60 organizations that we're working with that provide culturally relevant information on the vaccine, on testing, on housing resources, on career resources, sort of the whole prospect of what someone at this point might be needing to their populations that they have close relationships with. And that has been really beneficial when it comes to confronting some of those issues, those misconceptions and counter messages that are floating around, when those public health strategies are being not only coming through these entities, but also being directed, influenced back to us on what makes sense, what's appropriate, what they need most. So that's one thing we've been doing. We've been working through our federally qualified health centers. You know, there are a lot of different pathways that vaccines take to get to the public. One of those being federally qualified health centers that have a lot of a patient population made up of our focus community, BIPOC persons, persons with disabilities, LGBTQIA, people that fluctuate in and out of insurance statuses. And so we've been really successful in meeting the needs of that population, those populations, through our FQHCs who they know and trust and who have been instrumental really in our vaccine allocation thus far. We've also been working very closely with our independent tribal nations and really having them lead the direction on vaccinating their population since they know them best. And like was shared earlier, who shared that earlier, was it Alicia, I think, or it might, I'll backtrack, or maybe it was Adriana talking about, it was Adriana making those tough decisions on who's considered essential workers. I mean, I know that it's painful to have to make those decisions when we know that so many need a vaccine and we know that so many are ready to take it to then try and get themselves back to work, take care of their families, et cetera. And so we've really been letting our tribal nations guide that process for themselves. Another layer that we're working through right now are developing community-based vaccination sites. These are sites that would be set up in houses of worship, in community centers, places that people go often, that they know, that they feel comfortable, go for other services. Because again, we know that we want to create the lowest barrier possible for people to feel comfortable to take this vaccine. Like everyone on the panel shared today, there have just been compounding stressors that weren't created by the pandemic, but were revealed by the pandemic. And in no way in the vaccine distribution process do we want to compound any of those stressors. So we're doing what we can and working with community, being directed by community organizations on how to mitigate those. So one way would be to set up community-based vaccination sites where people go often, people frequent, feel comfortable going. Another component of that, an extension of that, are our mobile vaccination units. We are in the process of outfitting 2 buses that will be based in the metro area and will travel up to 1 hour outside of the region, and 4 buses that will be stationed outside of the metro area. The idea behind those buses, we're partnering with MnDOT, partnering with Met Council, partnering with Blue Cross Blue Shield to provide medical staffing services, are that we would go where people live, where they frequent, where they work, to provide vaccination, again, through the lowest barrier possible at those areas. No pre-registration required, very easy and seamless. So we're really working at the direction, again, at our community-based organizations to figure out where those places are to meet that need. So, that's just a lens, a little glimpse into the overall work that our division is doing. But, I think personally, I just want to say to all of you on this line, I feel everything that you shared today, both professionally and personally. And I came into MDH after serving 3 years in January as Deputy State Director for Senator Amy Klobuchar. So Carla, you shared that story about having to pivot your business. I remember last March being on the phone with business owners, asked me, what am I going to do? And how do I get access to federal resources? And, help me sort of walk through a plan of next steps. Or Adrian, you're stepping up and stepping into directly caring for COVID-19 patients and being on the phone with healthcare workers saying, I don't have any PPE. I'm working these crazy, like there's no direction, I don't know what to do. Or Pony, you know, stepping in and taking care of your siblings, and being a West African immigrant myself, thinking about my own family members who are in that situation, who have to put on hold portions of their life to provide a greater care for their family members. I mean, really everyone's, or Angel, you know, you talking about being with your staff and yourself and providing this essential service in grocery stores and managing your own emotions, managing the heightened emotions of customers that come into the store. I mean, all of that is just, it's a whole experience of the last year. And I think at this point where we're talking so much about rounding the corner, and it's true, we're getting there, but it doesn't mean that all of the experiences that were revealed this past year are going to go away. And so I think from the public health perspective, we really want to capture that whole experience and see how it can influence the way we handle these strategies, the way we communicate, the kind of tools we use to engage with our key populations going forward. So I really appreciate it. Thank you so much. I'm just so grateful to join you all today.
Thank you so much, Elizabeth, for sharing that. I was listening to NPR this morning, and a reporter talking about the importance of those vehicles, those mobile vaccine vehicles reaching folks, because people don't have access to internet, and we need to be directly going to those who most need this vaccine. So it's great to hear that we're going to be relying on and creating relationships with community to be doing this amazing work with MnDOT. So thank you for sharing the partnerships and the people who are making this happen. I want to pivot, and there's one voice we have not heard on this panel yet, which is Dr. Christina Ewig. You have produced some amazing research. And on this call today, we've heard a lot about how healthcare workers have been impacted mentally and physically. And so can you talk about, when we talk about health risks to healthcare workers impacted by COVID-19, what are the trends you are seeing currently?
Okay, Lacora, thank you. And thanks to the Women's Foundation for putting this together. I have really learned a lot, and all I can say is, wow, on these testimonies that we've heard today. And in so many ways, they reflect a lot of what we heard in putting together the report that the center produced on the impact of COVID-19 on Minnesota's workers, in which we used a race and gender lens. So I'm Christina Ewig, Director of the Center on Women, Gender, and Public Policy. And I worked with Matthew Bombeck and Amy Dorman, two students at the University of Minnesota, to produce our report last summer. And one of the big, I'm going to step back a little bit, Lacora, and just say one of our big findings was a dual vulnerability that women workers face in the state. And one side of that vulnerability are the essential workers that you have heard from today. So Angel's experience, Adrian's experience. That is to say that we estimated that 60% of the essential workforce that face high risk work. So we divide up the essential workforce into those that face high risk of the virus and those that have lower risk. For example, construction or a truck driver may not experience face-to-face interactions, but among those high risk workers, these are 60% women according to our estimates. And you heard about the stress and the toll that essential work takes on these workers. The other side of that vulnerability, when I said dual vulnerability, is the high number of layoffs. We saw in the closure period, if we look at the data on unemployment claims from our own state, we see that overall women were laid off at 14% between April and May, whereas men were laid off at 11%. But if we break it down into our different racial and ethnic categories, it's Native people and Native women in particular, where we saw 26% of in terms of their proportion to the workforce being laid off, followed soon by African Americans, where we saw Black men and women at 22% laid off. So that dual vulnerability was one key finding. And I was so grateful to have Carla's reflections today too, because we also in this report did want to cover businesses and weren't able to do so. To see that side that we know has been so impacted of farmers, which are small businesses, other kinds of small businesses, and their impact, especially on women-led businesses. I want to hone in on what I heard from so many of the folks today on this call, and that is the mental health impact. And that was something we carried out statistical analysis, but we also carried out purposeful interviews with leaders of community organizations and leaders of unions. And we weren't going in looking for mental health issues, but this came up over and over again, and you've heard it here. And I think that this really points to us thinking more deeply about how do we build resilience in the future? How can we rely on a workforce? And so here I'll circle to Lacora's question. How can we rely on a workforce that is majority women of color, that are working in our grocery stores, that are working in our front lines of our healthcare, that is experiencing so much mental stress in that work, right? Or even looking at Carla, who's taking 3 jobs in order to make sure that her farm can continue. So how can we build a basis, a basic floor that we can all build from? We need, like Adrienne said, she has more benefits than some of her peers in the field of being able to have flexibility on the job to see a therapist, of having insurance to see a therapist, of having an ex-spouse who can take care of her kids, whereas others don't necessarily have those networks. And so we need to build those networks, those basic benefits, so that everyone has stronger resilience every day of the year, and especially during a pandemic. So for those essential frontline healthcare workers, I would say in the healthcare area in particular, I'm worried. I'm worried, and it builds on the remarks that Adrienne made, that we see women across, and this is what Alicia also noted, we see women across the labor force leaving the labor force, and that's going to have long-term implications. I think that many of those that are in our frontline essential workforce are among the lowest paid. When we look at the folks that are working in our long-term care facilities, for example, the folks that are home healthcare providers, they may not have other options at the moment while we have very high unemployment rates. But as the economy begins to recover, I think they will think hard about whether or not they want to continue in this very stressful kind of job, and one which does not provide, and oftentimes very many benefits or high pay. And we rely on those workers for the well-being of our entire healthcare system. And so that's a worry that I have, and it's actually something that with a team of researchers at the University of Minnesota, we're hoping to look into. We're applying now for funding to look into that specific workforce because of that worry and their importance to our healthcare overall. I'll end there, but I would be able to echo so much of what people have said in terms of care, in terms of access to internet, in terms of their experiences are elements that we found in talking to people across the state this past summer.
No, that was really helpful, Dr. Ewig. Thank you for elevating this conversation with all the data and the trends. Because yes, mental health awareness and care is going to be essential. And so as I close out this conversation today, I first want to again just say thank you. But I also want to ask each of you, we don't have a lot more time, but I'm curious, what would be 1 to 2 key supports you wish existed for essential workers? So what do we need now? And in the long term, as we discuss recovery and transformation for COVID-19, do you wish for essential workers? And I'll start with Adrian.
Thank you again. As I've listened to all of the panelists, and I resonate with so much everything everyone said. It's been so wonderful and honored to be here. But I just want to say that I think we need to also think about healthy coping mechanisms. I know a lot, liquor store sales are at an all-time high during this last year. And I've thought about a lot of people are using ineffective ways to cope because it's easy and cheap and readily available. So I think teaching more people about effective coping mechanisms and having resources to provide a different option for people if they're not able to get into mental health care, because people will meet their needs whatever way they can. I think that's important. And with my teenage daughter, that some sort of teenage connection resources would be helpful, especially as young girls are already at high suicide rates before the pandemic, especially young girls of color, and now being kind of disconnected from everything. Definitely having resources for teens. I've just noticed that that's been a very tough time for teenagers, especially. I couldn't imagine being a teen right now during this.
Thank you. Angel.
When I think about support back at the beginning of all of this, and I think about where people are right now, and we've all touched on it and spoken very many times about it, but it's really that mental health piece. I don't know of anybody who is prepared to deal with what we've been dealing with. And even in what feels like kind of, rounding that corner, it still feels there's still so many unknowns. And I know there's a lot of people who are also wondering what's going to happen to them, like, I guess, when it's over or when certain protections are lifted and I guess, life goes back to normal. So the supports, I think that the supports that I wish had existed back then really were around that mental health support and a lot more transparent information. Even when it was scary, transparency, I think, was really important. And so I hope that transparency continues. I hope that long-term support includes mental health support. I hope that it includes continued resources for facilities that are supporting our community members, the ones who are who need it, who need our voices and our advocacy to continue to thrive and to not be forgotten. And I also hope long term that people continue to care for one another. And what I mean by that is, I always take into consideration when I'm interacting with somebody, trying to put myself in their shoes, their position, understanding where they're coming from, even sometimes when it might be something that I don't agree with, or maybe we have different views. So take care of one another. Remember, your essential workers are, doing their best to provide great service while taking care of their own personal lives, while feeling really vulnerable right now during all of this. So that's what I hope.
No, that's beautiful. Thank you. Pony.
I think long-term support that I have really noticed since the pandemic is support with childcare. 32% working mothers make up 32% of our workforce. And a lot of the conversation that we had during this discussion was about, people that had to take off of work, essential workers who, got laid off, people who, mothers and parents who had to, prioritize their children, or they were worried in my situation about where will their children go, or who will be able to offer them, academic support. And I know within the pandemic, it's difficult to, figure out childcare, especially when childcare centers were closed, or different providers had certain restrictions. But thinking about it, in long term, I think this really highlighted how inaccessible like our childcare system, even though it's not actually a system, is in this country. And so when we think long term, I guess I'm thinking like more support for families, more accessibility, affordability for childcare, so that, you know, like families are not worrying about like where their children will go, and who they'll be with. And I know this summer I sat in a lot of young women cabinets and panels where I was hearing young women nationally talk about how, you know, they had to start working because they had parents who were older and siblings who were younger, and their parents couldn't work. And so then their parents had to care for their siblings, but then they had to go start working at like grocery stores or like doing different things like that and juggling college. And when we center that, kind of like I shared with my story, how all of this is so interwoven and connected. And when our families don't have the right care, like how does that you know, trickle down and affect everyone else in that household? And even when we talk about, you know, health for teenagers and young people, how was that changed based on, you know, lack of, you know, childcare, lack of, you know, academic care, parents that are dealing with children with disabilities and learning disabilities, how were they centered in this moment? And so I think this has really shown us that we need to reimagine a way to offer like accessible childcare and help to families and working mothers and gender expensive people.
You better speak it. Thank you.
Thank you.
Carla, can we hear from you? What do you wish for?
I echo a lot of what people have been saying with mental health. Mental health is at a high in agriculture as well, both in the female and male population, as well as children of farmer families. We have a teenage daughter as well, so it's been very disheartening to see these children going to school at home and how to adapt without having a social life, that immediate connection in person, and to have that taken away, you know, that real college experience, going to college and going away off campus. So it's been a huge challenge for the teen population and academic sports. So just that whole mental health awareness piece is just key, I think. And when it comes down to food, especially in our state of Minnesota, is to support our local food shed. We have many food deserts in Minnesota. There are, you know, cities like Bemidji, they have one grocery store to go to. And we were recently part of a panel that had a discussion of how many grocery stores wanted to even purchase locally. And my own county didn't even have anyone on the phone call, and no one had reported that they were wanting to buy local. And that to me is really disheartening. As a farmer, I have an on-farm store. I have 25 local producers in that store, and I'm supporting other makers and other farmers. And that has been like so eye-opening to me to see all the amazing food we have in our own state, and just to bring local awareness to that and to bring it to the forefront in our own community is really important. I think for the success of farmers in our own state, to see them provide such fruitfulness. They work hard, long hours, just like many other industries, but food's for the soul. I mean, you need it. So it's definitely essential, but we need to do a better job of really promoting local.
No, thank you for that. We all need to eat. So yes, let's support our local businesses. And we also hear from Adriana. What do you wish for? Some key supports that existed for essential workers.
So I guess something that I wish for is that our emergency response systems are not human-centered and don't always take into consideration the fact that the work of crisis response takes a huge toll on the people implementing the plans, which is why there is a huge need now for additional mental health support for not only frontline workers, but for everybody. The pandemic has already exacerbated dire situations, and we really are in this together. And I think we need to emphasize that more, right? That community, we are community. All of us are a part of community. And some additional supports for the future could include childcare reimbursements, stipends, and or direct provision guidelines by employers in the states for frontline workers, as well as making provisions for similar initiatives for families that need additional care for their family members, such as elderly care or for those with disabilities. The Minnesota COVID Sitters is a student mutual aid organization that is trying to address some of these gaps, but we need a more sustainable response on a systemic level. I am looking forward to, after this conversation, hopefully being able to build connections with the ladies that are a part of this panel and with organizations across Minnesota. I mentioned earlier before that the knowledge, the expertise, it's right here in this room. It's in this space, you know what I mean? It's in the connections that we already have, and it's about tapping into those connections. Powerful we are.
Thank you, Adriana. You were breaking up a little bit. Thank you for sharing. Alicia, what are you wishing for that exists for essential workers?
In terms of like supporting essential workers, one thing I've heard really loud and clear, and that reiterating, is just like investing in our strengths. That when we're looking at grant making and investing in communities, you know, we're not people who are down and out, which we all know on this call. We're people who have done more with less. And so I think about like so many people out in the community who, whether it be through being an entrepreneur, being an artist, who are telling the stories, who are getting information out there, who are working in housing, healthcare, all of it. We have individuals even who are doing food access work and food sovereignty work, finding ways that when we distribute these funds through our processes, we're thinking about it through, as Ojibwe people could say, marauking, which is like talking about distribution, and like everything that we're given is meant to be gifted back out. And so I think about like all of what I've heard here today is how do we build Indigenous economies that are built by and for Black and Brown people, and that also include youth in our decision making. I think that's a really, really vital thing. And again, expanding entrepreneurship programs with a focus for people of color to be able to do that Indigenous economy building, and those supports for employers. One of the really big things that keeps me up at night is thinking about housing and food insecurity for Native people. And like, right, that all ties into this food sovereignty, to transportation, to all of it. But knowing that 55% of our people face food insecurity, and we're 26 times more likely to experience homelessness and houselessness. And so for Native people, Indigenous people, we're homeless in our own homelands twice. Once when we were removed, and again today. And so thinking about making sure that people have secure housing, full stop. Everybody deserves a house, and to be able to have wages that are meaningful, and supporting that. And so thinking about just like the overall how we design neighborhood level services to integrate across what I've heard today: mental health, childcare, physical well-being, all of it, pathways to meaningful wage jobs and pathways to home ownership. Because also when we look at who rents and who owns a house, we're in this like constant cycle as Indigenous people. We were already stressed out, we're already maxed out. We've got to worry about what's happening at work, with our family, in the community, and thinking about like, oh, when this eviction moratorium is lifted, or how am I going to pay my rent? Like making those decisions. Am I going to pay for my kids' boots, or am I going to pay for a pair of shoes to go running so I can take care of myself? Building that generational wealth includes housing stability and all those supports that wrap around in a culturally diverse way that recognizing that we have multi-generational homes. But at the end of the day, for Indigenous people to have the ability to either invest and to guide those investments, or to be in these spaces like this space right here, to build up more equitable infrastructure across all those areas.
Thank you, Alicia. Thank you, amazing testifiers, for your stories today. And my wish is that we can accomplish all the things that you are asking for. And so we started this session by listening to Black mothers and caregivers to honor all that they hold and lead in our community. I think now we will close our Road to Transformation listening series by listening to your experiences of life in this year's of unprecedented crisis and pain, and of the vulnerability you have been asked to take on in order to do our country's essential work, providing food, offering care in all of its many forms. And so thank you for your work and for your time today. I can give you my word that your stories and visions will stay with us. Your experiences and your stories and your truth are a part of our research narrative and are a part of why we engage in this work for gender and racial equity. So we listen to you, we honor you, and we stand with you. This will inform our strategies, our grant making for our future research, and our investments in crucial policy to create solutions. So we will follow up with the gift card and the report we produce, compiling the results of each of our listening sessions once it is published. And I also I can't say it enough. Thank you to our participants for sharing your stories of wisdom and vision. And thank you for listening, everyone, with us today. Thank you. Have a great evening.